a little crooked. It's fine. It's fine. All right. Hi, I'm Rachel Ambler. I'm going to be doing a skeletal muscle assessment on Alexis. Thank you for participating. So first, we're going to get started with the temporal mandibular joint here, TMJ. I need to remember that. Okay, so you feel here, have them open their mouth. Okay, you feel where the smooth slot is, and then you close your mouth. Good. You might feel clicking, or they might have pain if they have TMJ. She does not. Next, we're going to check the cervical spine. So you're going to palpate first, and you're just going to feel along her spine to see if there are any edema, any swelling, any inflammation. There's not. She feels good. Do you have any pain in your neck? Okay, can you put your chin to your chest? Good. Chin to the sky. Wonderful. Ear to your shoulder. Other ear to shoulder. Perfect. Oh, pop. And then chin to shoulder. Very good. Okay, so next we're going to do shoulders. You're going to palpate. You're going to see if there's any inflammation. Go ahead and move your arms. And you're going to feel for any crepitus. There are none on her. Good. Very good range of motion. You'll also want to test strength. So have her, I need you to put your fingertips to your shoulders. Okay. And you're going to push against my hand. Good. Now pull against my hand. Very good. So you'll do that on both sides. Next, you're going to work your way down to the elbow. You're going to check the range of motion. Look for pain. There may be pain from like a tennis elbow or golf elbow, depending on the side of tenderness. Do you have any tenderness here? No. And then come on down to her hand, her wrist. A lot of patients are sit at the computer all day, so carpal tunnel may be an issue. So to check, you'll do the tunnel sign, which you're just going to percuss right on this medial nerve. And a positive sign would be burning, tingling. Did you have any? No. Also, if that was painful, tingling, numb, you can have them do the Fallon test. So you're going to put your hands 90 degrees together. Is there any tingling, numbness, pain? Fantastic. Okay, so then you would work your way down to knuckles. All of the joints in the fingers, you're going to palpate, looking for pain, inflammation, same old story. Let's see. And you do that on both arms. So next, we're going to check out her hips. If you lay down for me. Very good. Okay, so you're going to palpate the hips. You're going to ask, is there any pain? No. And they don't feel out of place. Feel just fine. You're looking for any abnormalities. You can look for displacement and that sort of thing. So we're going to check range of motion. Go ahead and bend your knee. Fantastic. So we're going to go in. Good. Out. Up a little more. Was that painful? Okay. This is actually called the McMurray's test. You would perform this on somebody that had a trauma. Maybe we're looking for lesions of the meniscus. Not fun. Next, I'm going to check her knees while she's laying down. You're wanting to feel the joints. Sometimes there's fluid under the knee, the patella. And if there's just a little bit, you're going to do a bulge test, which is just tapping on each side of the knee to see if the patella fluid moves in there. If there is, you can do the Balatinette of the patella test. And so you're going to put your hand down underneath the knee and push up. And a normal patella sits right there in the femur. But if she had a positive test of the Balatinette, I'd have to look that word up again. But the extra fluid in here, you could see the patella floating in the fluid. Okay, go ahead and sit up for me. Next, you would check the ankles, you check for range of motion, you check toes, and each joint in the foot, go ahead and show some, yes, very good, up, down, side, good, out, very good. Okay, so next we're going to check her spine. I'll need you to stand up for this. Go ahead and turn. Yeah, there you go. Okay, so we're going to check for scoliosis. Main thing here is you're going to just look at the spine, see if she's symmetrical on the shoulders, the scapulas, and if she were in something, you could see her gluteal folds on. You'll also look for symmetry on that as well. Okay, so you're going to lean forward to touch your toes, and you're just going to feel each vertebrae all the way down. If you suspect any curvature, you can put dots on the most prominent spots, so like C7, T4, T8, and then L4. You can stand back up again. And if you mark each one of those and they show a little not straight line, then you might need to check further on some scoliosis. But Miss Alexis is perfect, of course. So thank you for being a part of our assessment.